Hi, I'm Dr. Prashant Rajpal. I work as a consultant psychiatrist in Bedford for the people over 65 treating their mental illness and memory-related problems.
Hello, my name is Marissa Manning and I'm a doctor in the East London Foundation Trust, and I work in general adult and old age psychiatry, and I have experience of working in the memory assessment service. Some of the key things to know about driving in dementia is that a diagnosis in itself is not a reason to stop driving. 1 in 3 people with dementia still continue to drive safely. However, as time goes on, dementia progresses and some of the mental skills needed for driving can deteriorate, including focus and attention, your memory, your patience, visual spatial skills, reaction time, judgment skills, problem solving skills. It's also important to know that most people with dementia will stop driving at some point in the middle stage of their condition, and some people may need to stop earlier due to symptoms such as hallucinations or impulsivity. The law on driving in dementia is very clear. If someone receives a diagnosis of dementia, they must contact their licensing agency immediately and inform them of their diagnosis. If you don't do this, it can result in a fine of £1,000. Additionally, you must also contact your driving insurance company, otherwise your insurance might be invalid if you need to use it. If you want to continue driving, again you still must inform your driving licensing agency, and they will send you forms to complete and contact your doctor regarding how to do this. Some people wish to stop driving themselves, and this is called surrendering your licence, and you can do that by contacting the driving licensing agency.
If following its inquiries, DVLA decides that the person is fit to drive, they will issue a license which has got a limited time period. Usually this limited time period is 1 year, but in the early stages of dementia they might be able to issue a license for maximum 3 years. It is a good idea for close relatives and family members to keep an eye on how the person's ability to drive. And if there are any problems, they can always report it back to DVLA, or they can speak to their GPs.
If the DVLA decide that it is unsafe for that person to drive, they must return their licence to the driving licensing agency and stop driving. That decision can be appealed within 3 to 6 months, but around that time that person still isn't permitted to drive. In some cases, your doctor will tell you that you should stop driving immediately because of unexpected symptoms, and in those cases that person should stop driving, even whilst they are waiting for the decision from the licensing agency. If the DVLA decide that it's unsafe for that person to continue driving, that person must return their licence to the driving licensing agency and stop driving immediately. They can appeal this decision within 3 to 6 months, but during this time they must still continue not to drive. And in some cases, their doctor may tell them to stop driving immediately, and this medical advice must be followed. Anyone supporting a person with dementia who has stopped driving can find these tips useful. Apart from using public transport, obviously, they can make use of a taxi service, making sure that they set up an account with their favourite taxi service so that they can use that service whenever they want, especially with shopping, going out. Make use of community transport or hospital transport services that are around. These are readily available. Setting up a direct debit to pay the bills makes it a lot easier, so they don't have to keep going out to the bank or post office to pay the bills. And finally, recognising and acknowledging that this is a very difficult time for them, a loss of freedom and independence, but they can still continue to live their lives easily and happily with this. It may also help out to point out to that person some of the positives about not driving, including less money spent on insurance, taxing, servicing that vehicle, less stress in having to get in the car to find places, more opportunities for exercise if they decide to walk, more opportunity to meet people on public transport if they want to do that. There are a minority of people who decide to continue driving against the decision of the driving licensing agency, and in those cases friends and families do need to take decisions on their best interests, and this might include options like parking the car out of sight so that person isn't being reminded of driving, hiding the keys somewhere so the person cannot get access to the keys and the vehicle, and even selling the vehicle so that the person cannot drive. Remember, these are last resorts, as they do cause a lot of frustration and distress within the family at times.
Many people suffering from dementia, they may choose to stop driving if they are feeling stressed or if they lose their confidence. They may stop driving if they are losing their way in familiar routes, if they are misjudging speed or distance, if they are straying across lanes or hitting curbs, they're causing passengers concerns. People may feel unhappy with stopping to drive when actually they've been so accustomed and independent taking their family and friends around. Stopping to drive make it so hard for them to visit their family, friends, visit doctors, hospital appointments, and so on. It is better to travel safely than risking an accident. For drivers with low annual mileage, it is better for them to use public transport or even taxis, which are often cheaper than running a car.